Today's video is a part two to our last video where a listener asked the question, do statin drugs impact memory loss? And that video concluded by showing papers that show that indeed statin drugs do impact memory loss and cause memory loss in certain people. And so this is a part two to that video where we can dive in further about looking at the importance of cholesterol to the nervous system, and is normal cholesterol good, is high good, is low good, and then where do statins fit into that picture? And this matters because this can impact your risk for Parkinson's disease, Alzheimer's disease, Huntington's disease, anxiety, depression, all kinds of different quote unquote neurological diseases. And so let's dive in. The first paper we'll look at is from the journal Experimental Neurobiology, and this was published April 2023. So a relatively new paper entitled Impaired Cholesterol Metabolism, Neurons, and Neuropsychiatric Disorders. And it starts with describing the role of cholesterol overall here. Cholesterol is the main component of the cell membrane. And remember, we are just trillions of cells. So cell membrane health is very important because the cell membrane is what's controlling electrolyte balance and allowing, say, glucose into the cell and taking waste out of the cell. Well, if you don't have enough cholesterol in the membrane, or you have too much in the membrane, that can lead to unhealthy cells. And if you've got enough unhealthy cells, then the entire organism can be unhealthy. So it's important to boil it down to cellular health here, because that affects the whole organism. So let's look at it. Cholesterol is the main component of the cell membrane, as we said. It aids in cellular influx and efflux by interacting with transmembrane molecules and regulates membrane homeostasis, such as permeability and rigidity. So if you have too much or too little, that's going to impact that rigidity. Cholesterol contributes to cell trafficking and signal transduction. Additionally, cholesterol is a precursor of steroid hormones and bile acids. All right, what are our steroid hormones? Cortisol, estrogen, aldosterone, testosterone, DHEA. So if you don't have enough cholesterol, that can create hormone issues. Bile acids, we need bile acids for emulsification of fats and fat digestion and absorption. Cholesterol is derived from dietary sources, so diet matters, or what's called de novo synthesis. De novo synthesis means the body makes it itself. Okay, so yes, diet contributes to cholesterol, but so does de novo synthesis, or your body's own production of it. There may be people watching this or listening to this that have heard of what's called familial hypercholesterolemia, and that is what it sounds like. It's a genetic contribution to high cholesterol levels. And so people with familial hypercholesterolemia have a genetic issue where the de novo synthesis is higher than normal. So they're making more than someone without that genetic issue. The cholesterol balance is maintained by cholesterol intake, by absorption in the GI tract, internal synthesis, storage, and excretion. So input, output, right? So that's the basic biology of cholesterol. Patients with familial hypercholesterolemia have an increased incidence of mild cognitive impairment. Okay, so this right here is saying those people with genetically higher cholesterol have increased incidence of mild cognitive impairment, which is a precursor to dementia. So high cholesterol could impact cognition. That might be brain fog, that might be memory. Okay, so at first blush, okay, high cholesterol could be driving memory loss and cognitive impairment. So let's get on a statin drug. We'll hold your horses there, okay? Animal models of familial hypercholesterolemia manifest cognitive impairment with impaired blood-brain barrier and neuroinflammation. So if patients with familial hypercholesterolemia have increased incidence of mild cognitive impairment, and animal models of animals with that familial hypercholesterolemia manifest the cognitive impairment with impaired blood-brain barrier and neuroinflammation, well, then maybe even in people with familial hypercholesterolemia, the genetic issue, maybe if we promote healthier blood-brain barrier integrity and reduce neuroinflammation as much as we can, maybe those would be people with the genetic issue that don't manifest mild cognitive impairment or dementia. So those strategies of promoting blood-brain barrier integrity and not being inflamed in the brain not only prevent dementia, but as we've talked about in previous videos, the primary cause of anxiety and depression is neuroinflammation. So reducing the neuroinflammation, which is one thing that helps promote a blood-brain barrier with integrity, not only prevents dementia, but also anxiety, depression, seizures, migraines, etc. Cholesterol metabolism in the brain and brain diseases. Cholesterol plays a pivotal role in the brain, where cholesterol levels are higher than those in other organs. Unlike other peripheral organs, the brain has limited cholesterol uptake owing to the presence of the blood-brain barrier. In the brain, cholesterol supply mainly depends on de novo synthesis. Okay, so the diet intake of cholesterol is not contributing to brain cholesterol levels as much as it is to levels elsewhere in the body. The brain cholesterol supply is mostly made by you. Okay, several enzymes, including 3-hydroxy-3-methylglutaril coenzyme A reductase, synthesize cholesterol. So there's multiple enzymes that lead to cholesterol production. That big 3-hydroxy-3-methylglutaril coenzyme A reductase is known as HMG-CoA reductase for short. That's a key enzyme because that's where statins work, and I'll show you that in a little bit. So you need that enzyme to make cholesterol. Statins target that enzyme for inhibition so that you don't make more cholesterol or to lower your cholesterol level, right? Well, if that enzyme is necessary to make cholesterol in the brain, would inhibiting that lead to memory issues and cognitive decline? Yes, we showed you papers of that last week. So interesting. What do? We have a conundrum here. Cholesterol is an essential constituent of the cell membrane, as we said, and in the brain, it regulates the shape of the cells or the neurons. It regulates ion permeability and cell-to-cell interaction or neuron interactions. In a meta-analysis, high levels of cholesterol and triglycerides in the blood had protective properties in Parkinson's disease. So here's where it gets interesting. There's studies that look at, hey, is high cholesterol bad in Parkinson's? Is high cholesterol bad in Alzheimer's? Is high cholesterol bad in Huntington's disease? And depending on the question you're asking, the answer can vary. So this is talking about in a study in Parkinson's disease, high levels of cholesterol and triglycerides in the blood was protective against developing Parkinson's. But then if you go the next highlight down, Huntington's disease is accompanied by cholesterol abnormalities, including low cholesterol, a decline in cholesterol synthesis, and cholesterol deposition in neurons. So in Parkinson's, high cholesterol and triglycerides is protective. In Huntington's, low cholesterol promotes the disease, and the elevated LDL in Parkinson's or in Alzheimer's, is associated with greater risk of Alzheimer's. So again, it's one of those questions of, Goldilocks, like too much, too little, or just right. Okay, so what's interesting here is I'd ask you to go to my YouTube channel and watch the video on the triage theory, or for those of you who are present for that video, I'll remind you that the triage theory discusses the body prioritizing the use of its raw materials, right? And so we talked about it in regards to longevity vitamins and cancer and lung cancer and smoking, and also mold, mold diseases. So this may be another example of triage theory. We've talked in the past that in studies on the elderly, higher total cholesterol and higher LDL is associated with lower death from infection and lower cancer. So there's multiple studies showing that high cholesterol is protective against infection because higher cholesterol and LDL bind the bacteria and the viruses and their metabolites in our blood and prevent them from making us sick. And so if we lower cholesterol, those people with lower cholesterol are at higher risk for cancer, higher risk for infection, etc. So might raising cholesterol when we're young, and that, when you're young and your greatest risk of death is from infection, right? Might the body be triaging or prioritizing raising your cholesterol higher to protect you from infection at the expense long term of that high cholesterol promoting dementia? So are you trading, a longer life when you're young, not dying from infection early, for risk of dementia later, but you had 80 good years first? To me, I would take that trade-off. I'd rather live, 80, 90 years and then develop dementia rather than die at 20 or 30 from an infection. So high cholesterol may be a triage theory adaptation by the body. Impaired cholesterol metabolism in neurons. I made balance blue because that's the key word. Cholesterol balance is correlated with normal neuron structure and function. Okay, so again, Goldilocks is key. We don't want too much cholesterol in the brain, and we don't want too little cholesterol in the brain. We want balance. Cholesterol is required for the growth of your axons. It's required to make synapses between neurons so that different neurons can talk in the brain and create pathways so that you can learn to read or write or sing or throw a ball or whatever it is you're trying to learn. When you learn something, you're laying down new neurons. And as you practice it, those neurons that fire together wire together. That's called synaptogenesis and synaptic plasticity. And so that's the nerdier term is neuroplasticity. The more you practice, the better you get, right? You need cholesterol for the development of those synapses and the learning and laying down of those pathways. Cholesterol in neurons and glial cells influences learning and memory, okay? And that's how. Without cholesterol, you're not making those synapses and those pathways and laying down those memories and learning that new task or move efficiently. So if you're insufficient with cholesterol, you don't have enough, you're not going to learn well or have healthy memory. Well, taking statins and lowering your cholesterol too much can negatively influence your learning and memory. High cholesterol in the blood exhibited cognitive impairment with altered neurons in the hippocampus. Okay, so again, that's the tie-in with Alzheimer's. The hippocampus is where our short-term memories live. Dementia is a loss of your short-term memory. It's an atrophying or damaging of your hippocampus. So cholesterol that's too high can promote that. But as I said earlier, perhaps that's an adaptation that the body made earlier in life to protect you from infection and cancer, but you live long enough eventually with high cholesterol to develop dementia. Personally, I'd take dementia over death from infection or cancer earlier in life. But maybe we don't have to have either. What if we have Goldilocks? What if we have balance? Okay, so let's keep going. Individuals with high cholesterol are at risk of cognitive deficits, as we've said. Similarly, cholesterol depletion, or cholesterol that's too low in neurons, reduces ability to form memories, which is called long-term potentiation, and damages learning and memory. So again, cholesterol that is too low damages learning and memory. Well, let's go up here to this image. All right. I added this to the picture. This was not here. But here's a picture of your brain, and it's showing you the pathway for creating cholesterol in the brain. And you can see it's multiple steps. And the second step uses an enzyme called HMG-CoA reductase. Well, statins block that step. So if we block there, you don't get the rest. You're not making cholesterol or any of these other reactions. Well, remember, it just said below, if your cholesterol is too low in the brain, you don't get learning and memory. So there's the pathway of how statins can cause memory loss that we talked about last week, and here it is in a newer paper. Why? Well, because if we don't have enough cholesterol, we don't get synapses, we don't get the neuroplasticity, we don't get those new pathways. So then we don't get the learning and memory we desire. Cholesterol depletion leads to decline in neurotransmission. All right, so if we don't have enough cholesterol, we also don't have good neurotransmission. What's that mean? You don't have good neurotransmitter levels in the form of serotonin, in the form of dopamine, in the form of GABA, Okay, so if you don't have enough serotonin, that could drive depression. If you don't have enough dopamine, that could drive apathy and lack of motivation and lack of pursuing goals. If you don't have GABA, that can drive anxiety and you can't motor down and go to sleep or let go of what so-and-so said earlier, or you'll be freaking out about your presentation tomorrow. So again, we need cholesterol for all of those things. We're taking a statin and driving it down too low. Now we may have mood issues or depression or anxiety. Patients with familial hypercholesterolemia have a higher incidence of cognitive impairment. Have we said that enough? Which may be caused by high cholesterol levels or LDL receptor dysfunction. In addition, elderly individuals with high cholesterol are vulnerable to cognitive decline. Yep, that's saying the same thing again. But again, was this an intelligent adaptation or beneficial lifelong as opposed to not having it or having too low of a cholesterol level? Taken together, proper cholesterol metabolism or balance is essential for maintaining the normal structure and function of neurons. You could say that a different way. Proper cholesterol metabolism and balance is essential for maintaining normal structure and function of the brain. The brain is made up of neurons. Okay, so if your cholesterol level is too low, your neurons can't wire together and you have poor cognition. If it's too high, long term, that can promote dementia. Cholesterol and psychiatric disorders. Cholesterol, as the main source of steroid hormones, plays a key role in the activity of the hypothalamic pituitary adrenal axis, okay, the HPA axis. We've talked about that in the past. This is the HPA axis drives your fight or flight response, right? So HPA axis is involved in circadian rhythms, sleep-wake cycle, cortisol circadian rhythms, melatonin circadian rhythms, sex hormone circadian rhythms. The HPA axis is involved in stress response and neuropsychiatric disorders. So cholesterol is the main source of steroid hormones and plays a key role in the HPA axis. If we don't have enough cholesterol, then our circadian rhythms can be thrown off, our stress response can be thrown off, and we may have anxiety or depression or some other neuropsychiatric disorder. Stress is closely associated with cholesterol metabolism. Psychological stress leads to altered cholesterol levels, including high cholesterol and a high incidence of metabolic disease. So we all give lip service to stress and psychological stress, but we often leave it there at levels that are too high for too long. Well, it's not this paper, but I was reading another paper this week that said psychological stress or mental stress can increase cholesterol levels up to 40%. That's a massive number. So psychological stress is just as dangerous and debilitating potentially as any of the other stressors like foods, bad foods, or smoking, or physical inactivity, or sleep deprivation. Your high cholesterol might be due to staying in the job that you hate or in the relationship that's unhealthy. Under stress conditions, individuals display increased serum cortisol, increased total cholesterol, increased LDL, and increased adrenaline. So when you're at your PCP visit and you have high cholesterol and they tell you to take a statin, don't you think first they should do a stress questionnaire and figure out what are the stressors or the tigers in your life and seek to address those first? That would be better, in my opinion, than taking a statin and leaving the stressors. Then you're playing tug of war with your own body. Here's a picture showing what we said in words. So a healthy brain can deal. If you have abnormal cholesterol metabolism, that drives neuropsychiatric disorders due to poor neurotransmission, so neurotransmitter imbalances, dysregulated stress response, altered brain morphology, changes in your steroid hormones, your cortisol, your estrogen, your testosterone, and abnormalities in learning and memory. Depressive patients exhibit high levels of cholesterol, which contribute to brain damage. High serum LDL levels have been detected in patients with depression, and these levels correlate with depression severity. Well, yeah, because we just said if you're inflamed, that raises your cholesterol, right? In previous videos, the one we did recently on mental health, we looked at the research showing that neuroinflammation drives anxiety and depression. Well, inflammation also raises cholesterol. So likely in these depressive patients, the high cholesterol isn't causal, but it's associated with the cause, which is increased inflammation. So rather than leave the inflammatory triggers and try and suppress cholesterol, why not remove the inflammatory triggers so that you don't drive the cholesterol up and you don't drive depression? Statin drugs are HMG-CoA reductase inhibitors, like I showed you. Remember, they block this pathway right here, HMG-CoA reductase. Statins can decrease cholesterol de novo synthesis and reduce steroid hormone precursors such as cortisone and corticosterone. So again, statins can, yes, they can decrease cholesterol, but is that even the right goal? In anxiety disorders, it is known that PTSD is related to chronic dysregulation of the HPA axis, including increased levels of corticotropin-releasing hormone and insensitivity to adrenocorticotropin hormone. So again, if we have stress and stress response dysfunction, that leads to PTSD, which is a psychiatric disorder. So again, we would want to address the tigers and address the actual causes rather than, just medicate someone and leave them with the triggers. So this paper showed accumulating evidence shows that cholesterol imbalance due to over or under supply of cholesterol or a dysfunctional cholesterol metabolic system results in neuropathologies, which can contribute to the development of different neuropsychiatric disorders. Impairment of cholesterol metabolism is associated with neuronal dysfunction, dysregulated neurotransmission, and neuronal cell death in the nervous system. Balancing cholesterol metabolism may be a novel way to resolve neurological symptoms in patients with neuropsychiatric disorders. And again, we don't have to go all the way to neuropsychiatric disorders. Balancing cholesterol metabolism may be a novel way to help people with learning and memory issues as well that haven't yet been diagnosed with an outright diagnosable disease such as dementia. So cholesterol plays a big role in the brain, and we want it to be Goldilocks, not too high, not too low. Now, as we saw many times, high cholesterol can promote dementia. Well, here's a new paper called Dementia Prevention, Intervention, and Care. Just came out in the journal The Lancet for 2024. And this paper is 57 pages long. We're not going to read through this, but what's huge about this is this was a commission that added 2 more risk factors for dementia development. Okay, so let's look at those. Evidence is increasing and is now stronger than before that tackling the many risk factors for dementia reduces the risk of developing dementia. In this report, we add the new compelling evidence that untreated vision loss and high LDL cholesterol are risk factors for dementia. Okay, so the previous risk factors were less education, hearing loss, high blood pressure, smoking, obesity, depression, physical inactivity, diabetes, excess alcohol consumption, traumatic brain injury, air pollution, and social isolation. Those were the 12 factors that increase risk for dementia previously. This new commission added vision loss and LDL cholesterol. So cholesterol is one risk factor of many that increase your risk for dementia. So if you have a high LDL, but all the rest of these are good, probably not going to develop dementia. If you have perfect LDL, but all the rest of these are bad, probably still going to develop dementia. So again, it's a puzzle, and we want to optimize as many things as possible and not get too myopic on one thing like cholesterol only. And so this paper was great, and they recommended different ways to take action against those 14 risk factors. Good quality education, access to hearing aids, treat depression effectively. Well, how do you do that? You first got to understand what the cause of it is, and mainstream medicine doesn't, right? We've talked about they treat it as under the serotonin hypothesis, saying depression is a deficiency of serotonin. That's not true. Depression is primarily neuroinflammation. So you have to find the inflammation and put that fire out. Encourage exercise, because people who participate in sport and exercise are less likely to develop dementia. Why? Because movement is life for the brain. When you're exercising and moving, you're driving the brain battery. So keep moving as long as you can. Don't smoke. Prevent and reduce high blood pressure. So they set the target of from 40 years on, you want to have your blood pressure, 130 or less on the top number, okay, as best you can. Detect and treat high LDL, okay, or rather than treat the LDL, figure out why it's being driven up and address that. Maintain a healthy weight, reduce alcohol consumption to zero. That's what I would say. Prioritize age-friendly and supportive community environments and housing, and reduce social isolation. Okay, social isolation 2019, there's a ton of papers coming out on isolation, and social isolation was seen to be a greater risk factor for death than smoking. Okay, being isolated, not having community is very detrimental to our health. We are social beings, we need to be in relationship. Make screening and treatment for vision loss accessible for all, and reduce exposure to air pollution. So wrapping it up, if you want to protect your brain, whether that's preserve memory loss, preserve cognition, prevent dementia, prevent Parkinson's or anxiety or depression, optimal cholesterol levels are going to be important. And the way we promote optimal cholesterol levels is reducing neuroinflammation and all the potential triggers for that. As well as, if dementia is your prevention is your main target, you want to target all 14 of these risk factors that were laid out in this paper. So let's open it up.
I think that lifestyle changes make such a huge difference, and all of the statins obviously impact as well, and medications impact, but the lifestyle changes, the little things that you can do to make a patient or a family member with dementia a little more alive in his thought process, in his eating habits, getting the sunshine, interaction, all of those things, Dr. Bartemus, that you recommend. All of that makes a huge difference in them, and it's really hard to pinpoint what it is exactly. But the statins are the medication in general, and how that impacts brains and organs in general is there's just not enough out there to fully understand how they impact it negatively.
Well, as it adds up, it's showing that there's more and more things it's doing negative to us. So like here in the abstract, which I didn't show you, but patients with neuropsychiatric disorders also have impaired cholesterol metabolism. Therefore, metabolic disturbances are closely associated with neuropsychiatric disorders. So again, here in that, what can I do to help? Well, if there's any sort of metabolic disorder going on, addressing that's going to be better than taking 5-HTP, say. A key metabolic disorder is metabolic syndrome. Okay, so that's blood sugar issues. It's a combination of blood sugar issues, cholesterol, high blood pressure, a high waist to hip ratio. Okay, metabolic syndrome, in which cholesterol influences altered brain function. So all the things that could contribute to metabolic syndrome or metabolic dysfunction can impact the brain. So dementia or Alzheimer's is known in some circles as type 3 diabetes. It's insulin resistance in the brain. So we want to understand not just, oh, we got to get their LDL down. It's like, well, are they insulin sensitive, right? Maybe they're demented because they have diabetes of the brain. They have type 3 diabetes. And so here in purple, therefore, reversing impaired or abnormal cholesterol metabolism may help restore neuronal injury found in mental illness. Yes, but a layer deeper would be reversing whatever's impairing cholesterol metabolism is likely to do it. So if someone is diabetic, then dealing with the blood sugar is going to be the best way to save their brain. Leaving them diabetic and just putting them on a statin is a double whammy for their brain, because now they have the insulin resistance of the brain. They have the statin that drives memory loss, as we've already seen, and the body is still going to raise the cholesterol to like push back against the statin, trying to lower it because the driver of the elevated cholesterol hasn't been addressed, which in that case would be at least the diabetes plus whatever else is going on. So even though we might not know, Sarah, which specific lifestyle thing of the many that you're doing for him is having the most impact, the likelihood is they're all having an impact. And as I've said before, from a neurological standpoint, there's this concept called spatial summation, which essentially says, if A is good for the brain and gets a result of one, A plus B is synergistic and gets a result of three. So stacking therapies, in this case, stacking positive lifestyle strategies together, diet, physical activity, proper sleep, proper hydration, is going to be better than just changing his diet and letting him stay sedentary, stay up too late, stay dehydrated. We want to, as you know, science nerds that are passionate about this, we want to know, well, what percentage of his improvement is due to the nutritional changes I gave him, and what percentage is due to the exercise I have him doing. That's all great, and we can try to noodle that out as best we can. But ultimately, if he's improving on the strategies you're on, that's enough clinical proof that you should keep doing that.